Hi, I'm Denise Simonette Mitchell with 1000 Days. I'm so excited to bring you all the second installment in our NICU Awareness Month video series together with the National Perinatal Association. Today, I'm joined by Carol Drybeldis, the Policy and Research Analyst at 1000 Days, and Kyla Romeo, Director of Strategic Initiatives at Feeding Matters and a treating clinician, a feeding specialist in a Level 3 NICU. So let's dive right in. On the heels of National Breastfeeding Month, please tell us about the role that breastfeeding plays in supplying the very special nutritional needs of babies born either sick or early and that are placed in the NICU.
Sure, I'd be happy to. Our NICU babies have specialized nutritional needs. They have different metabolic needs, and they also may be fighting significant medical complications that require specialized nutrition. But the good news is that tried and true motto that breast is best continues to hold true, even more so in a child that's born with prematurity or medical complications. That mother's preterm milk is different than term milk. The preterm milk has higher levels of protein and fat and certain minerals that preterm infant needs. And as the baby matures, so does the mother's milk. So it continues to be an optimal nutritional match. Now, it is true that some infants that have specialized medical requirements or in the NICU for prematurity do need additional supplementation, but breast is best.
And I'll just add to that, of course, really powerful benefits for infants in the NICU, but also for mothers. Lots of research shows that when mothers breastfeed their infants, they have health benefits long into the future, including a lower risk of high blood pressure, type 2 diabetes, and ovarian and breast cancers. So it's really important for both the health of moms and babies.
So Carol, you brought up a great point about the benefits to the mother, and it's also of equal benefit to the infant. Breast milk, especially designed with to support optimal gastric pH levels, which helps that infant fight infection. So babies that receive breast milk are at lower risk of infection, especially a particular disease that can impact babies born prematurely called necrotizing enterocolitis. And it also protects them from diarrheal infections, from ear infections, urinary tract infections. So breast milk has these positive health benefits for mother and baby.
Wow. Kyla, will you continue on and tell us a bit more about the unique nutritional needs of NICU babies, and also, I guess, a snapshot of what some of their special feeding challenges can look like?
Oh, I'd be happy to. Babies in the NICU often need higher levels of certain macro and micronutrients, specifically calcium and phosphorus, because calcium and phosphorus is extracted or transferred to the fetus primarily during that third trimester, 80% in the third trimester. And if the baby's born early or gestation has been interrupted, they don't get the benefit of that transfer from the mother. So often those babies do require a little extra boost with that preterm milk, or they may need supplementation. Also, babies may have different metabolic needs. So they need optimal nutrition, and they need it at the optimal density so that they're getting enough calories so that their body can continue to develop. The whole reason they're having to develop their brains as well as all the body systems and the tissue outside of utero. And so they need all the help that the breast milk and the mother and the family and the medical team can provide them.
Wow. So you both have touched on this a little bit, the fourth trimester and what it looks like during the in utero period and even post-delivery. So Carol, will you go on a bit and tell us about the 1000-day window? If you could share with us how it was conceived and simply what it means.
Sure, yeah. So when we talk about the first 1000 days, we're referring to the period from pregnancy up to a child's second birthday. And we know that there's really a tremendous opportunity in those 1,000 days to set the mother and child up for a healthy life, but there's also enormous vulnerability in that period. So it's crucial that they receive the nutrition care and support they need to thrive in that window of opportunity. So when we talk about the window in 1,000 days, we also, here at the 1,000 Days organization, we are the national nonprofit advocating for all of these needs of moms and babies in that time to ensure that they can have a healthy first 1,000 days. And we advocate for a variety of policies and programs that support families in that time, but nutrition and breastfeeding are one of those. Just making sure that women have the support they need to meet their breastfeeding goals, because the reality is that in this country, only about 60% of women are able to breastfeed for as long as they intend to. So it's really critical that as a nation, we support families to breastfeed through policies like paid family and medical leave, for example, and others that help establish and continue breastfeeding.
That's fantastic. So as a final point, let's together paint a picture of what a baby's nutritional needs may look like years beyond the NICU. Carol, we talked about up to that second birthday, that's within the 1,000-day window. Let's talk about that period and beyond.
Sure, yeah. So like we've been saying, breastfeed is the great foundation, and then at about 6 months, or when the child's developmentally ready, it's recommended to then introduce complementary foods. And once those foods are introduced, it's also equally important that they are kind of avoiding added salt, added sugars, and things like that. You really want a nutrient-dense diet to help little babies grow. And similarly, avoiding sugar-sweetened beverages and other beverages that aren't going to support that healthy growth and brain development. And so we kind of know these things are important, but again, in the United States, it can be difficult to make it happen. And about 60% of infants and virtually all toddlers do consume added sugars, for example, on a given day. So that's again another area that we need to support families to be able to have the access to the healthy foods they need to thrive.
And just to piggyback on what Carol was saying in regards to looking at the fat and the sugar and access to food, really what I was hearing as an underlying current was being able to provide support to families so that they can provide food variety, and that they can learn strategies for how to introduce foods and expand kids' diet in a way that is family-centered and pleasurable. So as we agree that we need exclusive breastfeeding up to about 6 months of age, and then complementary foods come in. But our children that have medical complications or may have been born prematurely are at greater risk of having pediatric feeding disorder due to those medical disparities. And pediatric feeding disorder has been newly defined, and the consensus definition was published in 2019, facilitated by Feeding Matters, and that is defined as impaired oral intake that's not developmentally appropriate. So if you go back and you think of a child that has medical complications, health disparity, limited access to resources, they're at greater risk of not developing all of the skills necessary for safe and pleasurable eating. Previously, it was thought that we need to limit certain foods that we expose our children to, taking out the big 8 allergens. But what we now know is that early introduction of foods in a variety of forms is optimal to protect against food allergies. Now, the only caveat is if you have a family history of a food allergy, that needs to be discussed with your pediatrician, and then together you can create a plan of how that food should be introduced to your child through family meal times. But we are in the business as supporters in our community and parents ourselves of producing children that are healthy, safe, and pleasurable eaters.
That's fantastic. Wow. Kyler, Carol, thank you both. This has been fantastic.
Thank you.
Thank you.